in which I keep on writing that what is to be done. So in very bad handwriting, because as the ideas come, I keep on writing it. Right? So, but it is like that. Today's project is kitchen sink, so it will be delivered. But then I'm putting in kitchen sink. It will be with two areas. Then over here I put a small motor. I'll be putting motor has already been brought. So when you want to wash the vegetables, right? So there will be one with the hole. ये पता है वो जाली वाला जो मिलता है. So you just put the fruits and vegetables over here, and from here, then you switch it on, and so this motor will detect it and it will put the jet flow at a very high pace. It is connected with soda bicarb chamber, a small plastic box, right? But small amount of that bicarb will come from here and it will start washing it at a very high pace. पानी उड़े नहीं इसलिए there is a like a small roof, so it will remain over there only, and whatever the kachra which comes out, right? क्योंकि वो प्याज हो या कुछ हो तो उसका कचरा भी निकलेगा. So it will jam the sink. So I put a crusher motor over here under hood. So as soon as it will detect it, right, it will start rotating. It will crush the whole kachra and go into the drain. Now drain should not also be मतलब वो भी नहीं भर जाना चाहिए. So यहाँ पे there is a collector. So water will go like this, and this thing will keep on collecting that kachra. So just once a week, you just take it out and put it into dustbin. Right? This section is for routine. So there is a water mixer, and plus I have given the line of RO also into that. RO is self-made. Normally RO, मतलब आप देखेंगे it will cost 15,000, 17,000, 18,000. कुछ नहीं होता. The circuit is very simple. I made it in 5,000 rupees. To be very precise, 48, so 4,800. I'll show you that also. Right? The only thing is it is not very hi-fi. देखने में crude सा लगेगा. But it's simple सी body. But say if you TDS meter से आप check करो and pH meter से आप check करो, got both the meters. So you check it and it will be absolutely top of the world. Because खुद ही बना है, so अंदर you can adjust everything. When I was in 12th, नहीं 12th नहीं, when I was in first MBBS रेडियो बनाया था. वो हमारे रूम में रहता था. My room was D55. I still remember D55. वो ऑन करने के लिए कुछ नहीं, दो तार जोड़े and then there was a preset. I think you know the preset, right? ऐसा एक छोटा सा preset होता है. So with screwdriver, when you rotate it, it will increase the volume. Rotate it, it will decrease the volume. And then there was station change करना हो तो there was a iron ferrite core, और उसके ऊपर there was that copper mesh. Just वो copper mesh आगे पीछे shift करो तो you can change the station. इसी के अंदर से थोड़ी there were riots, and when the police, they were talking on wireless. So one day when I was shifting, I found that even those frequencies they can be heard. So हम hostel में बैठे बैठे पुलिस क्या बात कर रही है ना वो सब सुनते थे. And this radio was favorite because इंडिया जो मैचेस जीत क्रिकेट का मैच में तब everyone was like absolutely कड़का. तो इतना छोटा सा स्पीकर था और स्पीकर को इतना बड़ा वॉइस नहीं था, एंड रूममेट्स एंड एवरीवन, सो ये सब एक जैसे ही थे. सो वी वर 12 पर्सन. अब 12 लोगों को कमेंट्री सुननी हो तो कैसे करें. वी वन थिंग, ये जो स्पीकर है राइट, उसके ऊपर वी जस्ट पुट वन कार्डबोर्ड, राइट, बड़ा सा कार्डबोर्ड, एंड एवरीवन यूज्ड टू पुट द स्टेथोस्कोप और कार्डबोर्ड के ऊपर रखते थे. एंड देन 4 पड़ी तो सब हाँ. दिस वाज द सीनरी. इवन वो पिक्चर भी है, किसी ने लिया था. आई थिंक आई वुड शेयर दैट. 12 लोग स्टेथोस्कोप लगा के यूज्ड टू लिसन टू कमेंट्री. Anyway, चलो, so for today.
Radiologists.
नहीं, ये तो एमबीबीएस में था.
Okay.
Two of them, they are surgeon. One is gynecologist. One another is He's in US. He became psychiatrist.
He
But
would be earning like anything, psychiatrist guy. That
same,
too in US.
that too in US. That too in US.
Sir, psychiatry and psychology are different, na?
हाँ बिल्कुल different. Psychiatrist जो है ना, he can prescribe medicine. Psychologist, he can do consultation.
Okay.
He can do consultation. साइकोलॉजिस्ट भी एक एक काउंसलिंग का सेशन का क्या चार्ज करते हैं, खतरनाक।
So what is better then? Like from the perspective of a patient.
कौन सा डिजीज है, इट डिपेंड्स अपॉन द डिजीज।
Okay, okay.
से इफ समवन इज हैविंग अल्जाइमर्स, तो अल्जाइमर्स में तो यार आप कितना भी काउंसलिंग कर लो उसको थोड़ा ठीक होने वाला है, बिकॉज इट इज अ प्रॉब्लम ऑफ।
Neurological disease.
हाँ, बट जो पता है, इफ समवन इज इनटू डिप्रेशन और, तो वहां पे वो साइकोलॉजिस्ट जो है वो काम लगते हैं। पर आजकल कैसा हो गया है कि अब उनको पता है कि इफ आई चार्ज 1000 रुपीज पर आवर, वो जानबूझ के खींचते रहेंगे दिल से कि यू विल बी रिक्वायरिंग 20 सेशंस। ठीक है, वी कांट कमेंट ऑन दैट।
Monetization of, I mean, businessification.
एंड टू एवरीवन, नॉट टेकिंग द नेम, जिनको जिनको जिनसे बात हुई इस वीकेंड पे, आई एम प्राउड ऑफ यू, आई एम प्राउड ऑल ऑफ यू, राइट, एंड फॉर दैट मेल एंड फॉर दैट पॉजिटिव स्टेप, एंड बी स्ट्रॉन्ग। I'm really proud of you. It is like, say, when you share such personal details, and then you are showing that courage to come out of it. Right? मतलब मैंने थोड़ा बहुत गुस्से में लिखा भी था, पर it was for your betterment. चलो. So we start with histology basics, right? Because this is the second last lecture. So next time we'll be taking the uh, histology slides. I'll show you the histology slides, and then on the Saturday we'll be taking the test. From next Tuesday, we'll start with systemic size, radiology anatomy, systemic anatomy. Right? That thing would go pretty fast. So be on your toes. Okay? Chalo. So today's session is on histology basics. If you understand this, you will not be facing any problem even in the pathology. And one more thing, there is one condition, it is called as the Carter-Jenner syndrome. We'll be discussing Carter-Jenner syndrome in detail because this is such syndrome कि अगर जो किसी को है आपने diagnose भी कर लिया, पर you miss just one thing, telling him or her that thing for rest of the life, when it comes like that they can't conceive the baby, और then you realize कि अरे ये तो मुझे पता था, होना ही था इनको, तो मैंने पहले क्यों नहीं बताया। That it becomes like a, no one can sue you, no one can touch you legally, but it's like a moral responsibility. Uske, right? So let's start. This would be a bit short session, but very important. So let's start with this. This is what human body, right? Human body. And in human body, we have got the connective tissue, we have got the muscles, striated muscles, smooth muscles, cardiac muscles. We have talked about it, right? There are neuronal tissues, and then this is the final, this is very important, epithelium tissue. Epithelium means which is present on the surface. Now you'll find that there is always a basement membrane, a membrane, right? This membrane, basement membrane. So this basement membrane, on that, there'll be different type of cells which will be sitting. How we shall identify? We won't be able to see the cells directly, remember. We won't be able to see the cells directly in many of the cases, but we'll be able to see nucleus very properly. So that's it. That be our identification mark, right? There is no vascular tissue in between. So these cells, they are studied wall to wall, wall to wall, wall to wall, they will go. So epithelium is what we'll be discussing today. Two types of epithelium. One, membrane. And second, glandular. Membrane is membrane, layer, right? Simply a layer. But when it comes to glandular, glandular means they will be secreting. What will they be secreting? Well, secretions, they are of different types. Say, for example, some secretions are oily secretions. Some secretions, say, for example, mouth, to they are watery secretions. Some secretions which are into stomach, to they are acidic secretions, right? That's why we get that पेट में जलन हो रही है, right? We take eno, fruit salt, or we take Alka-Seltzer or anything. So there are different type of secretion. So that means there must be something very special about those cells which are secreting it, and that secretion which goes into the duct. Correct? That goes into the duct. Pimples क्यों होते हैं? Because the duct is blocked. Right? Here is a skin. So this is a duct. That is a sebaceous gland. This sebaceous gland is secreting. It's secreting, but this duct, right? This duct is blocked. So that's why it swells. फिर because it is stagnant, एक जगह पे रहा, तो then it becomes infected. Then when someone breaks it, then the pus comes out. All these things. Right? So basically, it is a matter of cleanliness. No doubt, this is hormonal effect also. Hormones also affected very strong. So, and so there. So today we'll be focusing first on membrane. Its presence when it is on external surface, right? So that is skin. When it is into the body cavities, that means pleura. Now we know the pleura. So this was the chest, this is the lung. And pleura is the layer which is covering the lungs, correct? Which is covering the lungs. So that is called as pleura. When it is covering the heart, so we'll call it the pericardial. So the way this is pleura, same way the heart is also covered with a layer. So that is pericardial layer. Peri means surrounding. Right? Similarly, this is peritoneal. Peritoneal means
Kidney.
the abdomen. In abdomen, the entire, right from the right from the stomach, duodenum, jejunum, ileum, all the way, right, to cecum, to the colon, sigmoid colon, everything is covered with this peritoneum. Right? The peritoneum is a covering. So they are also, so they are called as body cavities. So they are also having epithelium. Then there are some body tubes. Body tubes means there is respiratory tube from mouth all the way to the alveoli, right? So from the mouth, then goes the trachea, then it goes into the primary bronchus, then it goes into the secondary bronchus, two tertiary bronchus, two bronchioles, and divide, and finally there is alveoli. And in alveoli over here, right, there is a blood vessel and there is oxygen carbon dioxide transfer. So this is like these are like tubes. Then GI tract, but obvious, right from the mouth to anal canal, right? It is the GI tract. Similarly, urogenital system, that is all the way from the kidneys, right? Kidney to urinary, to ureters, to bladder, to the अपना the external genitals, all the way. It will be going. That is what is called as the urogenital system. So again, these are the tubes. So there will be special lining. You'll be watching all these sections, 4x to 10x to 40x to 100x. 100x is oil immersion. All these things, they will be there on my trinocular microscope. So we'll be watching the real slides, right? And in that slide, what will happen? Okay, the slide which we'll be watching for 4x, same thing we'll watch for 10x, same thing we'll watch for 40x, same thing we'll watch for 100x. So that you get the complete perspective picture. Not like us, right? जब हम histology में थे तो मैंने आपको बताया था, I told you, right? We used to say हाँ समझ आया, हाँ समझ आया, कुछ समझ नहीं आता था. मतलब because तब क्या था, system was like ये slide. This is the area which is to be seen. Teacher तो pointer रखा हो. अब इतने सारे लोग देख रहे हैं, pointer हिल गया. Now it is showing something else. ना कैसे बोले? So many beautiful girls के नहीं समझ आया. जब एग्जाम आई तब अकल आई, नहीं पढ़ना पड़ेगा. But here there won't be any. So the functions are, हाँ यार बहुत खराब हालत है. So functions are protection, secretion, absorption, sensory. Like protection, so you understand skin, right? Protection, secretion, or these glands. Intestine, their function is absorption, secretion also, right? So it will secrete also, but at the same time, it will absorb also, because via that absorption, supramesenteric, inframesenteric veins, they will pick up these things and they will send all the way to the portal vein and then into the liver for the further metabolism. Sensory, right? Sensory, because if anything is hot, anything is cold, so everything is over here, receptors are over here. One of the best thing, one of the superb thing, my favorite, that is the active transport. So this is where when the receptors will come into picture, right? Receptors will come into picture and which will control sodium potassium pump. The sodium potassium pump right from the day one till the last day, it will keep on working on and on and on, right? So this is the active transport which will be happening. Okay. So let's start with the shape. There are various classifications. So we start with the shape. The shape is first one. For the types, the first is the squamous. Squamous means everything which is flat. So when things are flat, cells are flat, right? So cells will be something like this, like this, like this. But no, we won't be able to see the cells actually. But we'll be able to see the nucleus very clearly. A cell itself is flat, so the nuclei, they are also flat. But this is our identification mark. If we can see the cell, well and good. If not, nothing to worry. We'll just keep this thing in mind. This is the keyword. The height is less than the width, so that the cell is flattened. Cell is like this. Its height is less and width is more. If you remember this, the moment you see, I show you any of the slide, even if at low magnification, higher magnification, so you'll be able to see like a cricket ball. Right? You'll be able to see them so crisply. But in exam, not every time they'll be giving you oil immersion. Right? Oil immersion is bit delicate. Because what happens, a minor mistake, and that oil immersion will immediately break the slide. So it has to be handled very delicately. Because there is very, it is in microns, that's less space is there. So if you see the cells, they are flat, done. You are dealing with the squamous epithelium. And these are the cells which will be we'll watch everywhere, wherever the active transport. Say, for example, oxygen, carbon dioxide transport. So in alveoli, right? In alveoli, you'll see that single layer of those cells, and these cells will be having flat nucleus, and they are called as the alveolar membrane, and through which the oxygen, carbon dioxide transfer is occurring. The second group is called as the cuboidal. Now name cuboid, cube. So that means height is equal to width, right? Sahi baat? Height is equal to width. So in this case, nucleus, it has got space. So nucleus will become bigger. So this nucleus, round nucleus. So there is only one shape in the globular form in which height and width are same is round, right? So we have got the round nucleus. Do we see it with so much of precision clarity? Absolutely, right? Take my word for it. Next time we'll not be discussing any theory. Next time we'll be watching 100 of slides. Damadam, ek ke baad ek, we'll just watch the slides. But see the speciality. Squamous was for active transport. So cuboidal, you will see when secretion and absorption. Secretion and absorption kahan pe hota hai? GIT. Oh yes. So in GIT you'll be watching. Yes, exactly. In GIT you'll be watching layers of it. But all of them round nucleus. And actually they look like puri jo mala pehni ho na, aise round. They look so beautiful. The third one, which is called as the, you must have guessed, columnar. Columnar means height is more. When the height is more, so obviously for these cells, height is more than width. So this is the shape of the cells which you will watch as in they are called as the elongated nucleus. Right? No rocket science, easy. Elongated nucleus. This is also for absorption and secretion, but to a very specific areas, right? Especially the smaller intestines. So this is one in which we define the shape. But story doesn't end over here. There is second classification which is depending upon the layers. ठीक है, decide तो किया. But if this is single layer, so we'll call it simple. If there are multiple, So we'll call it stratified. So remember this word. It is called as the stratified. So now it makes sense. If there is one layer, say for example, alveoli, so we'll call it simple squamous. But then if there are multiple layers, say for example in skin, so it is not single layer, right? They are squamous epithelium, but एक layer, दूसरी इसके ऊपर तीसरी चौथी मतलब. But all the nuclei, they will be as if flat nuclei, right? So this is where we'll find it difficult to see the boundaries of the cell, but nuclei, matlab, picture would look like this. So we know that these are flat nuclei, they are in multiple layers, so that means we are dealing with the stratified. Stratified means something which is in layers, right? So stratified squamous. So same way, there would be simple cuboidal and simple columnar, right? One layer of cuboid, one layer of columnar. And then there would be stratified cuboidal and a stratified columnar, right? Every time, keep thing in mind, and I'll show you the slide. Right? My question would be what type of slide it is, what type of cell it is, and from the nucleus. Don't worry about कि मैं सीधा बोलूं कि this is for respiratory system या this is digestive system. नहीं, कभी मत करना ये. Histology is very tricky, right? But if we follow this sequence, it will become very easy. Trust me, by the end of 1 hour, or you will understand everything. And next time, by the end of 1 hour, you will be able to identify every structure of the body along with a reason. Bus, right? So this is fine. Stratified columnar. So when I've drawn like this, when I say draw, so you know that these are the elongated nucleus or elongated nuclei, right? And they are into multiple layers. Because if they're in one layer, तो सीधा one layer. ऊपर नीचे है. Obviously, this is right. So this is what. Now we watch for the variation. Can there be some variation? Yes, there'll be some variation. Variation is nuclei is seen at various levels, right? Nuclei, they are seen at various levels. So appearances, when they are at various levels, we call it stratified. Done. Right. Reality, can it be like this? Can it be like this? Then one cell is bigger, one cell is shorter. So nucleus will see that मैं किस type के cell में बैठा हूँ, and then accordingly it will become. So if the cell is small, it might be like a round nucleus. If this is a big cell, so this is like an oval big one. This is the situation. Right? It is called as, it would look like as if they are at various levels. But as such, everyone is grounded. You'll find that everyone is grounded. Right? Cell hai bade, but as such, if you see, एक छोटा nucleus, एक बड़ा, this is like this, someone like this. So you feel like yeah, multiple layers. But no, it is one layer only. And because it is looking like multiple layer, but actually it is not. So that's why they'll call it false. False stratified epithelium. But false stratified epithelium bolo to non-medicals ko samajh aa jaye. Right? So that's why we'll make a report in such a way that non-medicals samajh na sake. So we'll use the word pseudo. Right? So pseudo stratified epithelium.
So,
हाँ बोलिए.
can you repeat how can we identify pseudostratified epithelium?
Pseudo stratified मतलब देखो, this is the base, right? So you will find some nucleuses like this, some like this, some like this, so different sizes, right? So all of them, whether it is a big nuclei or small nuclei, mostly they'll be at the same level, their lower portion. Upper may be like this, upper may be like this, but mostly, see, this is nature, right? So it cannot be like you take a scale and then we put ke, हाँ, ये जरा सा भी ऊपर नीचे नहीं है. Minor, so they will be, but it would be like this. Where the nuclei they are, when they are stratified, they will like this. But in general, if I remove this part, so it might be mistaken as something which is at various levels. Yes. So their size would be different. Anyway, when you will see the slide, you will automatically come to know. Right? But in general, you got the idea that size of the cell is different. That's why nuclei, they are looking bit weird, right? Bit different. The best variations. This is for the urinary bladder, and this is what you have to imagine, because you won't be able to see this thing anytime on microscope. Reason? It occurs in live human. So when the bladder is relaxed, that means person has already visited the washroom and the bladder is relaxed, right? There is no urine into it. So in that state, it is the cuboidal. So that's how it will look like. It will be the cuboidal. So that means the nucleus, they will be round nucleus. Correct? Now, as the urine starts getting accumulated into the urinary bladder, there are muscles which are called as the detrusor muscles. Detrusor muscles. And the process of passing urine is called as the science of maturation. It will come into physiology. Now, this maturation process, that is super complex. So many pudendal nerves, and then the brain will be involved. There is external urinary sphincter, there is internal urinary sphincter. In case of female, there is only one urinary sphincter. But those sphincters which are voluntary, another one is involuntary. So it is the voluntary sphincter when the brain gets the message, ki, no, everything is right now, things are not comfortable, right? You are driving, so you can't pass the urine. Apply the extra pressure. But kidneys, so they don't understand anything. Kidneys to say कि अभी मुझे मेरा काम करने दो. So then every minute, right, kidney drop, right, few drops made, and via ureter, it will go into the bladder. Right, it will keep on. So bladder will say कि यार kidney बंद कर. नहीं, kidney से चुप, मुझे काम करने दो. So bladder, these detrusor muscles, they will relax. They will stretch. They will stretch. Right? When they stretch, the capacity increase, so that pressure has gone. Right? That pressure has gone because the bladder has got more capacity to accumulate. So then it is relaxed for some time. Again, the urine is getting collected. So when it occurs in urinary bladder, in relaxed state, it is cuboidal. When it is in stress state, so this becomes squamous. This becomes squamous, right? It becomes flat. It makes sense, right? Because the surface is getting stretched. Urinary bladder's epithelium, lovingly, it is called as the urothelium. Urothelium, right? And because it is moving from one state to another state, it is called as the transitional epithelium. Transitional epithelium. Transitional epithelium, it cannot be seen under microscope because either you will be watching it in a relaxed state or you can watch it in a stretched state because this is a live physiology. But so it can be seen only in cases if the endoscope is passed and that also with the microscope, then it can be seen. This is experimental. But here, remember this is a very important concept. The third type of staging, this is what is called as the projections. Projection, what is coming out, right? So here is one microvilli. Microvilli, they are like very small, right? It is like a very fine brush border. So that brush borders, its importance to increase the surface area. So because higher the surface area, the more the absorption can be done. So these are the microvilli. They are non-motile. Important is they don't move. Now, if we increase the size, now these villi, they are a bit longer in length and they are called as the cilia, or they are also called as the stereovilli. So size of stereovilli or cilia is more than micro. Micro means small. So they are bigger. Longer in length, but again, non-motile. So it means on the top of the cell, they are just standing like this because their purpose is increasing the surface area. So in case of epididymis, that is in male reproductive organ of Corti, that is it is into the ear, because organ of Corti is something which is handling the balance of your body, right? So organ of Corti, this is into inner ear. That is where you see these type, right? The third one, which is called as the cilia, right? They are motile. And last time when I was taking this lecture, someone said कि वो DDLJ में दिल वाले दुल्हनिया ले जाएंगे in movie है. Ghas which was moving like this, right? So we that's why in those notes it was written DDLJ because it was like everyone was like हाँ समझ आ गया समझ आ गया. And actually it is like that. So we can write it over here also, right? Actually it is like that. They are motile. They move like this, and that is the main concept for today. What it is? These are the hair-like projections, so they are quite big and they move. We'll see this thing into uterus, uterine tubes. Uterine tubes means fallopian tubes, right? Or the eustachian tube and throat. So first, see this is the bladder. Okay, I've drawn it over here. So this is the uterus, right? And this uterus is connected with fallopian tubes, also called as the uterine tubes. So this is the fallopian tube. Fallopian tube. And over here, there's ovary. So at regular cycle, one of the womb that is released and it will travel all the way, and it try to reach to the uterus. In case if it is fertilized, right? If it is fertilized over here, so then it will come over here into the uterine cavity and it will embed at one point and then it will start developing. So that comes the embryology. But that ovum, by the movement of the cilia, it will be brought all the way over here. Now, in case if there is any problem, it won't move, it will get fertilized over here. If it gets fertilized over here, then this is what is called as a fallopian tube pregnancy, and this is ectopic pregnancy. Ectopic means it is at a wrong place. Now, as this increases, it will burst open this fallopian tube. Permanent injury, I mean, mother might die. So that's why on ultrasound, when you see this thing, it has to be terminated, right? Because there is no point, baby won't grow, it won't be embedding properly, and it is impossible to have that size for the fallopian tube. So because fallopian tube, they have got very limited capability of expansion. It is a uterus only, which has got amazing capacity. So let's start with this microvilli. Now in these microvilli, as we said that in microvilli and stereovilli, they are non-motile, right? They are not moving. So they are just, their function is, they do contract like this, but they don't move like this, right? So their function is to increase or decrease the surface area. So here, this A is actin and outside is myosin. So here is actin, and then outside is the myosin filament. And in between, these are called as the binding filament. So actin myosin, so it is like constructing a wall, and then actin myosin, they are over there. To the basement membrane, there is spectrine, these S shape, what I have drawn it like this, S, right? So it is the spectrine which holds it. And then once again, there are protein, actin protein and the intermediate protein. Layers are there and they are connected. That's it. So they will be simply staying like this. So this is like a brush, right? This is like a brush border. Oh, so many messages very quickly. No cilia here. Yes. We are just coming to that. Good question. नहीं श्रेया, वो तो ऐसे बोला था, नॉन मेडिको तो इसलिए वी डोंट वांट टू कॉम्प्लिकेट द थिंग्स, बट क्या कि आजकल ना सब गूगल करके आएंगे एंड देन दे विल से कैसा सर ये मुझे ये भी डिजीज हो सकता है, एंड दैट वुड बी द रिमोट पॉसिबिलिटीज. Then later on I'll tell you something. So coming back to this, now we come to the cilia because this is most important. Now cilia is the most amazing thing out of all. Cilia it is motile, right? So it will be moving. If it is motile, if it has to move, then there has to be something like a component who can really move it. So for that, we need to see its structure. We start with our central tubule. So there is a central area in which there are two tubular proteins. So these are like two tubes which are going. So that's why it is called as the tubular proteins. There are two tubes. Surrounding the two tubes, there are nine triplets. Triplet means तीन का combination, right? So there is ये दो तो जो हुए अपने tubulin protein, right? So this will be one tubulin protein, then will be second tubulin protein, and then there is one more protein. And this is called as the dynein. Dynein. Right? So dynein protein is at every level. All the nine triplets, they will be having nine, all will be having the dynein protein. Got it? Now this is a 2D structure. What we drew over here, this is a 2D structure. Now same structure, second, third, fourth, fifth. So that's how the complete 3D structure is made. So this is like one floor and the entire building is of 100 floors. So that's on every floor, you have got similar structure, 9 triplets everywhere, right? These dynein, they are like motors. You can, for the ease of understanding, we can say that they are like motors. So they contract, right? They contract. And in between, they are called as the spike protein. So spike protein is the connectivity of this triplet to the central sheath. Right? So thus the skeleton is ready. So here dynein, we said that they are like molecular motor. Yes, they are like molecular motor. Nothing should go wrong with them because they are the main function. Because बाकी की सब चीजें तो सब में है. It is this component, dynein, which is leading to movement. Right? Now those, the way movement requires energy, motor requires energy. So here, apna all-time good, ATPase. Right? ATPase is an enzyme and for the ATP activity. So that ATPase is used. The rest of the structure, the blue line which I've drawn, right? This blue line, the pura framework, outer one. So that is called as the nexine. Right? These are called as the nexines protein. Okay. Keyword, dynein is a molecular motor.
So,
हाँ,
what is nexin protein present for?
nexine का क्या?
What is nexin protein present for?
Nexine, they to give the structure to outer structure, right? To outer ring. This is also called as the ring protein. Ring protein. Yes, happy Ganesh Chaturthi. So dynein, that
So
is
then that is covered everywhere.
which one?
Nexin protein is covered throughout everywhere.
Ha. On
Cilia.
every ring it would be there. On every ring. So every ring it would be, yes, nexine. Right? So in general, if the structure is like, say, there'll be a tubular structure round, and then these are like tubular protein, and then we have got the dynein. Such 1, 2, 3, 4, 5, 6, 7, 8, and 9. All of them, they are connected with spike protein. And this is one structure, such second structure, third structure, fourth structure, and all of them, they will make the complete cilia. So when this side of motors, they are contracting, so cilia will move like this. When opposite side would contract, so cilia will move like this, right? So that's how, these are the motors which will be controlling it. I always compare them with the servo motors. Servo motors. Servo motors are the motors which we use in drones. Okay? So in drone, the effect of servo motor is that they are low voltage, right? They are low voltage motors, and they move with very precision. You can even move it slightly because the fan, right? Its function is just rotate the blades, right? If there are few more rotations or few less rotations, it really doesn't matter. Servo motors, they are not like that, right? They move, you can move even in them in microns. So that's how these cilia are there. So cilia, this is the fallopian tube, right? And these cilia, they are moving, so they are taking the ovum from one point to the point. So this is a motor, that's a dynein for body. Lack of dynein. And lack of dynein means everything is fine, just these dyneins, right? They are not functioning. When they are not functioning, so obviously cilia is there, so we'll say cilia. But they have become immotile, so that's why we'll call it immotile cilia. But then we'll call it syndrome. Yes, syndrome, because there'll be multiple complications. There'll be multiple sign symptoms. So that's why collectively we now call it as immotile cilia syndrome. Let's see this. First one. Sapna, you said that in nose, yes, it is present into our nasal system, our all the paranasal sinuses.
Yes, sir.
That's the reason the mucus, right? Mucus that is moved, right? That moves. Now, if these cilia are not working, so you don't even realize that when you swallow, so that mucus is going into your digestive system, and we don't even know that, right? But now that mucus is not formed, so it will start getting collected into the paranasal sinuses, PNS, right? Because it is not moved. Now, and anything which is stagnant, it will become infective. And that is what it will lead to chronic sinusitis. Chronic क्यों? Sinusitis हुआ, person took the treatment, person took the steam, everything fine, now feeling better. But वो शाम हुई, once again शुरू. Again, after a few days, he is complaining. That's the reason it becomes chronic, right? And this thing can occur at any age. Second, you come across the X-ray. Right? You come across the X-ray, the moment you see it, immediately you diagnose that this is a case of bronchiectasis. Whenever it is bronchiectasis, do ask, call the patient. Right? 1 minute लगता है, but पूछ लो. क्या पूछना है उससे पहले we watch one more X-ray. I'll show you the X-rays also. You watch the heart. Heart on the right side. Now, this is like खतरे की घंटी. If you see bronchiectasis, ectasis means everything becomes stagnant. Bronchiectasis means bronchus, they are dilated. They are dilated, kitna? Huge dilation, right? So when there is huge dilation, so that means it will lose the pressure. So that's why सब चीजें वहीं की वहीं पड़ी रहेगी, right? We'll just show you. Second, what you do is, and on X-ray chest, now you know it very well that heart is on the opposite side, so you call it dextrocardia. Correct? Heart is on the opposite side. So, देखा के heart is like this, right? And यहाँ पे L mark है. Technician को phone किया कि दोस्त ठीक लिया है ना X-ray? He said, yes, sir, absolutely fine. वो heart उल्टा ही है. ठीक है. He has said that this is heart उल्टा है. What you will do next is you'll watch for gastric bubble. Gastric bubble, right? Gastric bubble is on the left side. But in this case, gastric bubble is over here. What does
Gastric
this?
bubble or fundus?
Gastric bubble is because of fundus. This is the
Okay.
stomach. मतलब यहाँ पे this is fluid. So यहाँ पे जो gas है, that gas will be seen, right? As a round blackish area. So you'll be able to see it. And on opposite side, on right side, you won't be able to see that because वहाँ पे तो बड़ा liver बैठा है. Liver के अंदर there is no air. Right? So there is absolute opacity. So clearly you'll find this thing, gas bubble. That's why it is called as a gastric bubble. Here, gastric bubble would be seen on the right side. So इसका मतलब क्या हुआ? This is not a case of dextrocardia. This is a case of इसका नाम क्या? Situs.
Situs
Sinus
inversus.
something.
Inversus.
So gastric bubble, it has shifted here. Because over here, in this side, the liver agya, that means everything has gone ulta. Right? Everything has gone ulta, and this is called as situs inversus. All organs on opposite side. Now,
Sir,
even
sir, why does it occur? Means like ओरिजिनली ऐसे ही लोकेशन रहते, बाद में रोटेट होता है, ऐसा होता है क्या कुछ?
I'll tell you. Just 1 minute. 1 minute.
यस यस।
So say for example, even if you are a radiologist, right, you are not dealing with the patient directly as such. वो तो patient जो है बाहर बैठे हैं, एक के बाद एक्सरे आपने रिपोर्ट किया कि this is a case of dextrocardia with situs inversus, bronchiectasis है, भेज दिया, मेडिसिन वालों ने ट्रीटमेंट शुरू कर दी, एंटीबायोटिक शुरू कर दी, पेशेंट घर चला गया, पेशेंट इज फाइन, बट नो, नाउ इट इज योर रिस्पॉन्सिबिलिटी. व्हाई? You are watching a case in which the patient's history, इस पेपर पे लिखा है कि this is the 7th episode in 6 months. That is chronic. And then you take X-ray and you see that it is situs inversus. Dextrocardia तो immediately दिखता है, but from gastric bubble you find it situs inversus. To be doubly sure, you tell the patient to send the patient to sonography. You just put the probe because it's a matter of 10 seconds, right? You just put the probe and you find that liver is on the opposite side. Liver is on the not on the right side, it's left side. Spleen has gone to the opposite side. Sab ulta. So that is confirmed, right? This is a confirmed case of situs inversus. All organs on opposite side. Now see what happens. When someone is having chronic sinusitis, क्यों chronic sinusitis? Because those villi, they are not moving, so mucus is getting stagnated. ठीक है? One. Bronchiectasis, same reason. In respiratory system, it is the mucus which is getting shifted up. वो वापस ऊपर जा रहा है, so that tracts they remain clear. Now it is not moving, so mucus is getting collected. Now, situation over here is still bad because there is so much of less space and the mucus is getting collected. So that's why these are all such tissues कि जो आराम से expand होते हैं. So those bronchi, which are very thin, they become big. And they become big, mucus is remaining there. So वो mucus, it will start सड़ना शुरू होता है, infection develops. And that's why the sputum of the bronchiectasis patient, that is horribly smelly. When you'll go to this medicine ward, right, वो नीचे कटोरा पड़ा होगा, बड़ा weird लग गया, but वो नीचे कटोरा पड़ा होगा, but it is so smelly that instantly you know that this is the case of bronchiectasis. X-ray dekha, within 1 second you know that this is a bronchiectasis. What confirmatory diagnosis? You also watch for the CT scan, and I'll show you the CT scan also. You find that signet ring confirmed, right? 100% confirmed, and then you have to give one warning to that patient if the patient is young. And what's that? Whenever there is chronic sinusitis, whenever there is bronchiectasis, and you find it situs inversus, because in embryology, these villi, there is what is called as the rotation of the digestive system. When we'll be studying abdomen, right? So first we'll understand embryology. पहले 2 lecture embryology के होंगे. Then we'll be going for the entire anatomy. Reason, if you know embryology, तो you will know that ये rotation कैसे हुआ. When things rotate, they rotate along with arteries. They rotate along with nerves. So you don't have to cram कि अच्छा ये superior mesenteric vessels ये कहाँ से कहाँ जाएगी, mesenteric क्या होगी, celiac plexus will supply what, superior mesenteric plexus will supply what. No, you don't have to worry. It is exactly the same pattern. You understand the embryology. The thing is, when the organ develops, it moves along with its nerve supply. It is not so that organ is developed and then like thak thak thak, right? Spider-Man की तरह वो nerves फेंकना शुरू किया. No. They take the nerves along with that. That's why nerves will be having those specific paths. In digestive system, this is amazing. The whole rotation, it takes its arteries, it takes its nerves, it takes its plexuses, and then it goes for the rotation. Because the cilia has got the problem, so that rotation never occurred. So that's why things remain as it is. But the growth though is normal. So the organs, they're fully developed into their normal size and shape, but rotate nahi hue. So that is what is called as the situs inversus. All these things so you have managed, right? And now you have got all the right to collectively say it as a Cartagena syndrome. This is called as the Cartagena syndrome. When there is chronic sinusitis, more than 2 episodes in last 6 months, in last 3 months, more than 2 episodes, on X-ray you see the bronchiectasis, and then there is situs inversus confirmed. So then you can stamp it as Cartagena syndrome. But the third thing is, these patients, chances of these patients having sterile means they are unable to deliver the baby, right? They are unable to conceive. The male, then the male has got the big problem because of the sperm motility. Sperm motility is very less. Okay, those sperms, they won't move at all. They will die there only. Right? So that sperm motility is very less because of the problem of cilia. So in such cases, this is called as primary cilia dyskinesia. Primary cilia dyskinesia. That is a problem. Right? But this, no one would know. So when patient is having say chronic sinusitis, bronchiectasis, situs inversus, and then you say, okay, send him for sperm examination. The patient would say, ये क्या है? This is the reason. This is the reason. Genetic anomaly or the radiation effect. Anything can occur. So, but these are the 4 important things. Now let's see how do we really see it. Look at this X-ray. Look at these X-rays. So when you see this X-ray, some things which you can instantly identify, and that is, okay, this is the dextrocardia and here is the gastric bubble. So it is on the opposite side, right? It is on the opposite side. But do you really see that there is such a big bronchus, which are seen over there, right? Huge bronchus. If it is not very clear, don't worry, right? But at least this thing you can identify: 1, that is
Yes.
dextrocardia, and
Yes.
2, a gastric bubble. Now, let's see this. Let's see this. In this, you need to know just the axis. So if I say axial CT thorax, axial means it is horizontal, correct?
Horizontal.
Horizontal. Then there was coronal, like coronal. So if I take a coronal section, so I'll be able to see shape of the lungs, correct? Both the lungs.
Yes.
Will be going like this. And the third section, that would be the sagittal. Now, sagittal, so it will be passing through the midline. So sagittal section is of no use to us at this point, at least in this case, right? So that's why we are relying on first axial scan. Now, I ask you something. There is some todfod going on, but I hope that sound is not harassing very much. Is it okay?
Nothing, sir. It's very minor.
Very
Mhm.
minor. I already put a filter over here so that sound is dampened. So then it is good. So think you have to go for a bit of imagination. यहाँ से शुरू करते हैं ट्रेकिया में से डिवाइड हुआ प्राइमरी ब्रोंकस सेकेंडरी ब्रोंकस टर्शियरी ब्रोंकस डिवाइड लास्ट में पहुंचे. So these are all bronchioles. That bronchiole which is a very small bronchiole, and then उसके बाजू में कौन होगा? उसके बाजू में होगी blood vessel.
Alveolar.
Blood vessel. हाँ, alveoli तो ये this thing will end in alveoli.
Mhm.
So that will end in alveoli. और उसके साथ जो होगी, that would be the blood vessel. So things are like, so even if you see on normal CT scan, and if you are going for what is called as the lung window, right? ये थोड़ा technically I have to explain. Lung window means, so normally X-ray when we take, the X-ray is like a fixed thing. ले लिया X-ray and then the plate is given. On CT, when you are sitting on the terminal, you can increase or decrease because this is a digital image. The way you can increase or decrease brightness and contrast, over here you can increase or decrease the penetration. You can increase or decrease the penetration because CT scan is what? CT scan is nothing but there is gantry, right? Gantry means कि जिसके अंदर patient को डाला जाता है कि go, right? Patient is inside and then patient is inside. And this is as if you are watching the patient from its leg, from his leg side. Right? Patient under hai. And then those beams, right, over here, these are the X-ray beams over here. Not one, but there'll be multiple. It is called as the array. Array means arrangement. 8 balar is Y. Arrangement of multiple X-ray beams. So they will be fired, they'll be firing. So it is like a X-ray is taking the slice, right? On the opposite side, there are sensors. They are called as the CCDs, charge coupled device. But just understand, they are the sensors. So as soon as every ray, thak, 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 right? ऊपर से fire किया, these sensors they will receive, they will send it to central processor and Fourier analysis and the image is generated. Now you are watching it on the screen. You want to decrease the intensity. If you decrease, so you know that when the intensity is decreased, right, all the rays, they won't be able to reach to the sensors. So thus you can allow just how much sensor you can really watch, how much image you can really watch. नहीं. मुझे 10 मिनट लगे. So that is, these are the sensors. Central processing unit, and then it is made. So lung window, what it really does is, our focus is not on bones. So all the bones will look similar, but the lungs, they will be seen with sharp clarity. So this is the lung. Now, if the bronch is enlarged, but the artery will remain same. Bronchus is having air, right? So this outer portion that will be taken, and inside there is air, so it will look black. While this artery, the artery is filled with blood, so it is like this. Correct?
Hmm.
This is this clear? Right? So this is what is called as the signet ring. Signet ring. Anguthi jaisa. So this is the ring, and then on the top there is a diamond, right? So this is what is called as a signet ring. Here also signet ring is seen very prominently. See this? The dilated bronchus and the dilated bronchus and the artery, right? Dilated bronchus and the artery. So they are, but still better if you really want to see. I got one more image. And over here, see this, so much of dilation, and then there is these arteries, right? All these dilated things, what you are watching, right? See, otherwise, normally these bronchus, they are not this much dilated. Right?
Sir, one question I had.
Bolo, bolo.
Since they are filled with mucus, shouldn't they be white?
But mucus, the density of the mucus, right? The amount of mucus which is present, they are so dilated that you see some air. Not
Okay.
every bronchus will be seen. Yes, you are right that in some of the cases, because there will be so many bronchi, right? So many of the bronchi, if they are studded with mucus, so yes, again, they won't be imparting same shadow. But not all the muci, all the bronchi, they will be filled off. Right?
Okay. So they just, due to increase of accumulation of mucus, they dilate, but we can still see some air through the X-ray,
Correct.
CT scan.
So I'll tell you why it happens. Say, for example, this is the bronchus. This is the bronchus. And then there is a mucus plug over here. So there could be dilatation over here. Now this area is having air. Because ये mucus impaction तो randomly होगा. So let it remain there. So that's why it will dilatation.
So, sir, will it be
Okay.
seen opaquely?
So bronchiectasis, this is irreversible dilatation of bronchial tree. Irreversible, right? These are the keywords: distal, non-cartilaginous part. This is distal. That means it is not happening in trachea, not happening in primary bronchus, not happening in secondary bronchus. Because see,
After tertiary bronchioles, right? In
yes,
tertiary bronch.
that's right. So these are the cartilage, right? Which are keeping them open. So big tubes, they have got the cartilage. But those smaller tubes, that's where the dilatation happens. Because if it is reversible, so we call it bronchial dilation. Here it is irreversible, so that's why it is bronchiectasis. So here there is bronchial wall thickening, there is mucus impaction, and this occurs classically because of fibrosis. Diagnosis is by CT.
Sir, can you explain what fibrosis is?
Fibrosis is the tissues, right? They are now converted into those fibers which are non-contractile. They can't contract. Right? This is like a dead tissue. So because they cannot contract, they cannot stretch. So now they restrict the capacity of the lung to dilate. And this
Okay.
is as good as is a non-functioning lung.
Sir,
Okay, thank you.
Someone asked.
this is seen in workers who work in industries like fibrosis, lung fibrosis.
Say fibrosis, so it's a huge chapter. But say what you are calling is the occupational lung disease. Those who are diamond cutters, those who work in coal mines, right? It can lead to atelectasis. That means things which are
Asbestosis and
right in the paint
asbestosis and
industry,
silicosis, no?
that silicosis, etc. So you will be able to see all those things like in the form of that dot 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 dot, and there you see this bronchus involvement. Occupational lung disease. So even why they say that it is necessary to have the air purifiers, because there are such particulate matter, right? They are called as PM, particulate matter 1.0, 2.0, 2.5, 4.5. These are all various particulate matter. Some of the particulate matters, they can settle into the lungs and they decrease the efficiency of your alveolar region, called as a PM, particulate matter. I'll share you a screenshot. Let me show you. What it has really done is, as the work is going on, right, immediately, say, even if the air purifiers are working here, I think if you can see, this is showing 89% of the air is good, but for the analysis, air quality is healthy, environmental comfort, and when you click on that, right, see, this is VOC. See this one red line?
Yes, sir.
Yes.
Right? That thing, this is into 144 mg per meter square, which is absolutely unhealthy. It is giving the warning because of that they are breaking the walls, so that dust will it goes into the atmosphere. Some dust it leaks into the bedroom, right? And there it is checking up that the sensors are there, so it is sending me the message constantly. The message is that air is unhealthy. So that's why the air purifiers, they have boosted and they are going at the top speed, right? So that they just process the whole thing. They are called as the HAPA filters. Very important when you go to sleep. At that point, it plays a major role. Do people with Carter syndrome live without any complications? Wouldn't there be? Carter syndrome, when it is full-fledged, yes, they do have complications. They do have complications. Means intensity changes. Right? Intensity changes, but yes, they do have problems. So, right, normally bronchus size and alveolar, this bronchus size and pulmonary artery branch, they are of same size. This is when the dilated bronchus, and it is called as signet ring. So this is a portion of the zoomed portion of the hilar of the lung. See, this is how it really looks like, signet ring appearance.
So Hyla, what was Hyla? Could you repeat?
This is the lung, right? Or let me
Yeah.
draw the left lung. This is the lung.
Yeah.
This region is called as the hilar region. Hilar.
Okay, through where it branches out.
Through which this is the trachea, right? This is the
Right.
trachea. So it is via this hilar region the bronchus, they enter, and the
And it
pulmonary
spreads out and
artery,
branches out.
and then it branches inside. So this is the region. That's why, and see over here, this is like classical, not one, but so many signet rings they are seen.
Okay.
This is a clear indication that dilated bronchi. While the pulmonary artery branch, this is pulmonary artery branch. So they are of the same size. All right, so that's it for today. Right. So I'll upload this image, this file. Thanks a lot, and see you next time. We'll be watching all the slides, whatever we discussed. Thank you.
Thank you, sir.
Thank you, sir.
Thank you so much.
Thank you, sir.
Thank you,
Bye,
sir.
sir.
Thank you, sir.
Bye-bye.
Bye.